We're talking with Dr. Joseph Bovi, Physician Chief of ThedaCare Cancer Care. Thank you so much for being with us, Dr. Bovi.
Thanks so much for the invitation, Cass. It's a pleasure to be here.
So to help us understand what this disease is, we're going to play a little game here. We're going to do a 4, 3, 2, 1 countdown, and we're hoping that you can expand on some of the topics.
Happy to do that.
Okay, let's take a look. 4. What are the 4 main symptoms people should watch out for?
That's a great question. So the 4 symptoms that we worry about with colorectal cancer are unexplained belly pain, unexplained diarrhea, bleeding from the rectum, or low blood counts. And if you have those symptoms, bring those up to your primary care physician so that appropriate investigations can happen.
Do sometimes people ignore them because they think it's normal?
I think they absolutely do, and especially when we discuss some of the at-risk populations, younger patients who are diagnosed with colorectal cancer can easily overlook those symptoms.
Does everyone experience these symptoms, or are they sometimes not happening at all?
That's a great point to make. Many cases, and perhaps most cases of colorectal cancer, are silent, meaning that patients aren't having any symptoms, and that again underscores the importance of screening.
Absolutely. All right, number 3, name 3 risk factors for developing colorectal cancer.
Sure, another great question. So age, increasing age, is one risk factor. Another risk factor is having a family history of colorectal cancer or genetic syndromes that would predispose you to colorectal cancer. And then the final one is poor lifestyle choices. A sedentary lifestyle without exercise, obesity, increased consumption of alcohol, increased smoking, eating processed foods. All of those risk factors are going to increase your risk for colorectal cancer.
All right, versus the things we cannot change, like age.
Absolutely. That's something that we can't stop the Earth from rotating around the sun.
Yes. All right, number 2 here. Can you talk a little bit about 2 recent cases in the news, Catherine O'Hara and James Vanderbeek?
I think all of us have heard about Catherine O'Hara's unfortunate passing at the age of 71 from advanced rectal cancer. I think what her diagnosis underscores is that this is a diagnosis of an aging population. Most colorectal cancers are diagnosed in patients that are greater than 60 years old. And it shouldn't cause alarm. What we need to do is actually increase people's recognition of the importance of screening. Screening works. Most colorectal cancers are able to be cured if they're diagnosed at early stages, and that's exactly what screening is designed to do.
And James Vanderbeek?
That's the other end of the spectrum that's really unfortunate. James Vanderbeek passed away at the age of 48 from advanced colon cancer. And this is an unfortunate trend that we're seeing in colorectal cancer diagnoses, is that colorectal cancers are being diagnosed more and more frequently in patients that are less than 50 years old. And I think there's many reasons for that. Younger patients, at least in this day and age, have more sedentary lifestyles. They perhaps are more at risk of being obese, eating processed foods, increased alcohol consumption. All of those things, as we had already heard about, increase your risk of colorectal cancers. So again, it's critically important to partner with your primary care doctor. If there are any of those symptoms that are happening, you absolutely need to bring those to the attention of your physician so that appropriate investigations can happen.
Okay, those are really, really good tips to know about. Okay, number 1 on here. What is the number 1 most important thing we can do to prevent colorectal cancer?
The number 1 thing that you can do is listen to your primary care doctor with regard to their recommendations for screening. And in this day and age, screening happens at the age of 45. That was actually recently decreased from the age of 50 because of those increased cases of colorectal cancer that we're diagnosing in patients that are less than 50 years old. And there are so many options in this day and age, Cass, for screening. And with your primary care doctor, it's important for you to understand which of those regimens would be important for you or the most appropriate for you.
This has been very great information, Dr. Bovi. Thank you so much for being with us.
Thanks for the opportunity. I think this is just great.